Hi, I'm Dr. Maria Horvat at Horizon Health, talking to you today about Pap smears. Pap smears have changed a lot in the past decade. It used to be that you had a Pap smear every year, but now the recommendations have changed. The recommendations were changed based on the fact that we were not changing the mortality of cervical cancer by performing Pap smears every year. Currently, the recommendations are to have your first Pap smear when you're 21 years old. Thereafter, you have a Pap smear every 3 years, as long as your Pap smear is normal. Sometimes we also check for HPV, which is the human papilloma virus. If you have a history of abnormal Pap smears or a history of uterine cancer, history of HIV, being immunocompromised, such as if you had a renal transplant and you're on a high dose of steroids, if you smoke cigarettes, you still need to have an annual Pap smear. Once you've had a hysterectomy, as long as it was benign, then you no longer need any Pap smears. Once you're 65 years old, as long as all your Pap smears have been normal in the past decade, you also no longer need Pap smears. If you get that phone call that's very worrisome that says your Pap smear is abnormal, it just means that there's a red flag. It means we need to take a better look. That usually entails colposcopy. Colposcopy is a procedure that we perform in the office. You can drive yourself to this procedure. We place a speculum in the vagina and place a vinegar solution and then look with a microscope. We then take biopsies if we see any abnormal patches. The tissue is then sent to pathology. If the results come back consistent with mild dysplasia or normal, the recommendation will be for you to follow up in 1 year for another Pap smear. If the results come back moderate or severe dysplasia, then the recommendation is to perform further treatment. Patients with moderate or severe dysplasia have an increased risk of cervical cancer, so all of those abnormal cells will need to be removed. It's important to remember that moderate and severe dysplasia is not cervical cancer and is completely treatable. All of these cervical problems are completely treatable as long as you come in on a regular basis.